Hello, my name is Dr. Tiffannie Skerritt. I'm a medical officer employed by the government of Montserrat, and I work with the Ministry of Health. My current assignment is to secondary healthcare, which means that I work with patients in hospital, but I also have a bit of experience working in primary healthcare, which is more in the clinic setting or the district setting. So kidney disease is defined as the presence of some form of damage to the kidney or decreased kidney function. And we're basically able to measure this by taking blood tests or urinary tests that help us to measure key markers. So in 2020, a study was conducted looking at chronic kidney disease in Montserrat. So I spoke of kidney disease earlier. Chronic kidney disease is basically damage occurring to the kidney or loss of function of the kidney that occurs over a longer period of time. So it's not a sudden deterioration, it's progressive. And usually chronic kidney disease is attributed to having uncontrolled comorbidities or other illnesses. Usually we connect chronic kidney disease to uncontrolled diabetes, uncontrolled hypertension, and dyslipidemia, or factors such as obesity and having uncontrolled cholesterol. Now, as I said, it has multiple factors that contribute to it. And on Ireland, we are able to support our patients in various ways. So under the Ministry of Health, we have a number of district clinics that exist in various parts of the island, and scheduled at these district clinics are particular clinics for persons who have high blood pressure, which is hypertension, persons who have diabetes and other comorbidities. And within our setting, what happens is that persons with these illnesses have the opportunity to schedule an appointment with a doctor who they can see quarterly or more frequently if necessary, where they're able to be reviewed by the nurse, reviewed by the doctor, and have that conversation about how well they're being controlled in terms of their chronic illnesses. And if during their annual tests, their annual blood tests and urinary tests, it's detected that there has been some decrease in their kidney function, we aim to optimize them. When I say optimize them, what do I mean? So chronic kidney disease has various stages. And for the first few stages, the way that we help to reduce the progression, or we help to improve persons' overall well-being, is to control the very illnesses that might have caused them to develop kidney disease. So we try to improve control of their high blood pressure. We try to get control of their diabetes, whether it is through lifestyle changes, whether it is through the addition of medications that will help to reduce their blood glucose over time, help them to lose weight, because we know that obesity is a factor that contributes to elevated blood pressure, elevated blood sugar. And in so doing, we're able to slow their progression or help to reduce, for those who don't have chronic kidney disease as yet, help to prevent them from developing chronic kidney disease. So right now, our means of managing is through screening in our district clinics, and for early diagnosis and early referral for those who might have end-stage disease. So in our current setting, we do not possess the equipment locally to facilitate hemodialysis. So what is hemodialysis? If you think of your kidneys, which are the two bean-shaped organs that are located in the back of the body, they really act as a filtration system. They help to excrete those elements of the blood that are no longer useful or that are present in excess, in addition to a number of other functions like processing vitamin D, helping to produce hormones that help us to prevent anemia, etc. So in a case where somebody has end-stage kidney disease, that is when we look at their blood results, we look at the urinary results, and we calculate their kidney function, we realize that it's at a rate that is below a certain percentage. These persons are better managed in settings where they have access to hemodialysis or peritoneal dialysis, which are just two mechanisms by which we're able to assist persons with clearing those elements of waste that are in the blood that they can no longer process because their kidneys aren't functioning optimally. So in the case of Montserrat, because of how frequently or because of how many persons on our island have chronic illnesses, what we call chronic non-communicable diseases like diabetes and hypertension, the risk of developing chronic kidney disease is automatically increased, especially if those illnesses are not being well controlled. The presence of a dialysis machine or some form of dialysis equipment here would be helpful because it would mean that long-term care for those patients who have end-stage kidney disease could be facilitated here on island. Currently, for those persons who have been diagnosed, our mechanisms of managing them is usually early referral to a country or an island next door where they can get regular and consistent dialysis. And for those who opt for the UK route, some of them migrate and are able to follow up there and join that system. So in that way, we would be able to facilitate long-term care of our chronic kidney disease patients, end-stage patients here on Ireland, if it is worth to get the machine. And what would that mean? It would mean that we would have improving morbidity and mortality, reduction in mortality for those patients who would ideally want to get care, but maybe aren't able to afford it. It would also mean that families can stay together, because if it is that you have chronic kidney disease and you're unable to get care here, then you have to move. The option does not exist for you to remain here. So it's keeping our society together, reducing migration, also improving the health and well-being of our patients who have been diagnosed, and enabling us as a healthcare system to take care of our patients to the very end. What message would I like to provide for people who have kidney disease in our community? All right. My message as one of the many practitioners who work here is try to get on top of your chronic illnesses. Stay regular with your doctor's visits. So whether you choose to follow up privately or in the public system, if you have an appointment with your doctor and it's supposed to be every month or every 3 months, ensure that you keep your appointments. When we have the discussion about lifestyle modification in terms of increasing your activity level and improving certain things in your diet, try to get serious about that and do your part in controlling those diseases that are predisposing you to chronic kidney disease. And in areas where we're unable to control it with lifestyle change, if you're prescribed medications, you ensure that you collect them from the pharmacy, you ensure that you take them as prescribed and as consistently as possible, because our aim is to control the underlying illness that is leading to the chronic kidney disease. And in cases where we've been able to catch it early, that is to say, you might have been diagnosed with chronic kidney disease at an earlier stage, and you have not progressed to the stage where you need dialysis, you do everything that you can to reduce that progression. For those who are end-stage kidney disease and are requiring further care elsewhere, my recommendation is that you work along with your family. You have that conversation with our ministry. Through the Ministry of Health and Social Services, there are avenues by which we can provide financial and other support to facilitate long-term care. If you've gotten a referral from one of us as your local doctors, you take that seriously and you begin to put plans in place to fast track getting the best care possible. And if that can be done in an island close by, you have friends or family that can allow you to migrate, do that. If that option isn't available and you have to move further afield, begin to make those plans sooner rather than later. Because the sooner you have an intervention, especially in the case of chronic kidney disease, where you can have what we call renal replacement therapy, there's no dialysis machine or there's no some step in place to take over the function that your kidney is unable to do, the longer and healthier that you can live. And that's what we all want, to live long and healthy lives. So I just want to end by saying thank you to those who are listening. And of course, you have an opportunity to play your part by supporting Helping Hands for Glendon. Thank you.